to speak of the porcelain. Hope all of you will bear with me. I'm presenting this evaluation of myeloperoxidase as a non-invasive marker in the ulcerative colitis. As all of us know, that ulcerative colitis is a disease with remissions and relapses, and it is possible that low-grade inflammation leads to the relapse. So we need to detect this low-grade inflammation so that we can prevent a relapse. We can prevent the mortality, we can prevent the morbidity in this population. It's also possible that direct assessment may provide us a quantitative pre-symptomatic measure of imminent relapse. Targeted treatment can avoid relapse or formulate a new therapeutic strategy to maintain the symptomatic remission. What's remission? As FDA defines remission, that it should be absence of inflammatory symptoms, that's rectal bleeding should not be there, diarrhea should not be there, and we should document evidence of mucosal healing in the form of absence of ulceration, significant granularity, or fibrillation. As all of us know, that ulcerative colitis is a disease of the colon with friable mucosa, and putting this patient to the stress of colonoscopy is not without dangers. The preparation can predispose a relapse, preparation or the procedure itself can lead to the complications. So basically, ulcerative colitis is a chronic inflammation of the gut. Usually lymphocytes and plasma cells are infiltrated, and it's in the acute exacerbation that neutrophils migrate and degranulate myeloperoxidase, lactoferrin, eosinophilic chemoattractive factors. We just wanted to see a biomarker, a non-invasive measure, how we can see without subjecting a patient to colonoscopy to see whether his gut is inflamed or not. What are the qualities of a good biomarker? It should be simple, it should be disease specific, it should be easy to perform, and it should be able to objectively measure the disease. It should be, of course, non-invasive, it should be economical, it should be rapid, and we should be able to reproduce it between labs and individuals. Based on this, if you see a fecal marker, it is a non-invasive and economical marker, and it reflects the gut inflammation in a non-invasive manner. There are various inflammatory markers which are released in the fecal matter, and which we can detect and see whether the gut is inflamed or not. We studied it at Postgraduate Institute of Medical Education and Research, Chandigarh, India, this fecal myeloperoxidase, and 2005 to September 2006 patients were studied, and all patients gave a written consent. They underwent a clinical, endoscopic and histological assessment for disease activity and severity, and estimation of fecal myeloperoxidase was done at baseline and after the treatment, on follow-up. What were the exclusion criteria? Patients more than 60 years of age were excluded, patients with history of prior colectomy, evidence of malignancy and infection, and toxic microcolon, these patients were excluded from the study. This was done in controls also. We took 48 age-matched healthy controls, which were mostly staff members of the department, and they were not having infection beforehand. So all patients were subjected to the Mayo score calculation based on stool frequency, rectal bleeding, sigmoidoscopic appearance, and physician's global assessment. Based on this, we calculated the Mayo score. It was 0 to 2 remission, 3 to 5 active, 6 to 10 moderately active, and 11 to 12 severe disease. Based on this, we calculated Mayo score for each patient. This was the binder classification, grade 1 to grade 4, which is usually known to all of us, that we graded the patient at the endoscopic severity. And based on a Gibbous classification, we described the mild, moderate, and severe classification based on the chronicity score and activity score. This was the classification used in the histological classification. May I remind you that this is one of the studies where pathological classification was correlated with the clinical, endoscopic, and non-invasive markers. So why we chose fecal myeloperoxidase? We chose fecal myeloperoxidase because it reflects the intestinal inflammation in a non-invasive manner. This molecule is a very stable molecule, remains for 3 days in the stool, so that the patient can take the sample at home. He has to get a fecal sample to the doctor, to the laboratory, and it does not get, it is a very stable molecule and does not get altered with the biochemical reactions.
2 minutes.
I'll just rush up. This was the Bradley et al. The ELISA technique is used to see the fecal samples. We studied 55 patients, who most of them had proctosigmoidoids, and we found that cases were having more levels of myeloperoxidase than control. This means that a patient with IBS symptoms can be definitely characterized by the myeloperoxidase levels. Of course, we did not find that there was any, we could not detect the extent of the disease. Myeloperoxidase can be elevated in all the cases, mild, moderate, and severe, and extent we could not determine by this. However, the patients who had severe disease, they had higher levels of myeloperoxidase compared to those who had less severe disease. On the follow-up, we treated these patients and found that there was a drastic fall in the Mayo score, their rectal bleeding improved, and so was the change in the myeloperoxidase levels. So this, I would conclude that fecal myeloperoxidase is an effective non-invasive marker in assessing disease activity and response to the treatment. This is a non-invasive test, a fecal test. It's very simple and economical test. You can ask the patient to get this fecal sample, and you can assess in a non-invasive way, without subjecting the patient to the colonoscopy, that whether his disease has gone down, or whether he is in a state where he is for an imminent relapse. If his levels continue to be higher, you may have azothioprine, or you can check the compliance of the patient, whether the patient is taking the drugs or not. I hope this will help the ulcerative colitis population and our fellow gastroenterologists very well, for the non-invasive means to detect the inflammatory ulcerative colitis disease. Thank you very much. I hope I can help.
Thank you. Next speaker is Al-Duni from Urdun, King Hussein Medical City, where he will talk about